just a little nerve pain, but that's it. But as far as migraines, none whatsoever. I've got to walk through the mall, which I never get to do because there's so many people and flashing lights and strobe lights, and that's a migraine waiting to happen. Christmas, you know, went through, did shopping, got scared, said, oh my God, migraine's going to come on. I know it because there's flashing lights everywhere. But nothing at all. It was more psychological than anything.
That experience that you might get a migraine was. Yeah, you know, as we've kind of discussed before, I'm going to take a look at your incision here as I speak. But as we discussed before, your situation was really interesting, where you had that blood vessel on top of the nerve, in addition to the fact that the nerves come through the muscle, which they do always. But so I released that muscle, placed fat around it to pad it, but also made sure that that blood vessel was no longer in contact with the nerve. And I think that's why you had such an immediate change in your experience with the migraine headaches, because you for your entire life probably had this blood vessel that was pounding on that nerve. And then when that was no longer there, you know, it was immediately different. And, you know, of course you're going to, you know, be able to still have kind of pain back there and tension headaches, but I think the migraines were caused by the stimulation of this blood vessel, and perhaps also the muscles themselves on those nerves. You know.
And actually, when I woke up in the hospital the next morning, anesthesia kind of wore off, and you know, I had a couple of visitors, and they're like, "How do you feel?" And it's like, you know what? It's like I've lived in a fog. It's like the sun is shining, the birds are singing. It was like immediate, and ever since then, I mean, even if I'm having a bad day and, you know, I got a little pain, I can't help but smile, because it's night and day, and I can't even describe the way I feel.
And that's where your experience is so fortunate, like for you, in that not every patient responds that way. Some patients don't respond right away. Some patients respond later. Some patients sort of fluctuate a little bit. And again, not everybody is helped. But the overwhelming majority of people are helped, at least 50%, and certainly enough that they recommend it to friends without a doubt, because migraines are so terrible to have a 50% reduction. But your situation is really extraordinary, and that's why you know, I think it's great that you're willing to share it with other people.
This last year, it's been amazing, between the Botox, which, you know, I never thought, like, that's crazy, but you know, after seeing, you know, the videos on YouTube and discussing it with you, I mean, that was, you know, I had migraines here and there, but compared to the amount of time I spent in the emergency room, loss of work, just not able to function with my children the way that, you know, you'd want to, this last year has enabled me to do that. And now I'm just hoping for an even better year this year. You know, everybody's like, 13's not a lucky year. Well, guess what? It's going to be my lucky year. Awesome. I'm very happy, and I can't even explain it. And, you know, like I said, you know, we've got a little bit of nerves and work, and, you know, I'm getting there. But
well, and you know, and again, you know, what are we at? Just a little bit beyond a month, right?
I think we're like at 6 weeks.
6 weeks, yeah. And so for you not to have any migraines in that time is, again, exceptional. Like that's really exceptional. And even if you had, in my opinion, 1 or 2 migraines in that time, I would still consider this a massive success, given how frequently you had migraines. But it's just so rewarding. And, you know, again, it's not perfect. You bumped yourself that one time, experienced some pain. But in terms of what it's done for the migraines, I think it's profound. And you're right, I think it will turn out to be your year.
And I like to say, you know, even coming back to work, thinking, okay, I'm going to come back to work, and I know I'm going to end up with a migraine. No, I'm still...
No, you had something so anatomic, like it was, and if I'm not mistaken, the right side was your worst side,
yes,
right? Yeah.
Yes.
You got them on your left,
yes,
right?
Yes.
But the right side was the worst side. So I think you're a patient who, like, the muscle and the way it squeezes on the nerves, that's important. But for you, what made you have that kind of almost daily experience of migraine about to happen or having one, and then being so long and protracted, was that you had that very interesting finding of a blood vessel that sort of traveled the whole course of the nerve, and to separate that physical interaction between the two is, I think, what creates such a profound change in you. because you had that constant irritation.
And you know, I've had so many friends that, you know, get constant migraines, whether it be hormone induced or light sensitivity like myself, and they're like, okay, is it working for you? And yes, and so they're like,